Happy New Year! I'm David Porter, Vice President of Health Policy at the Illinois State Medical Society, and I'd like to take a moment to identify a few issues that physicians can expect to encounter in 2016. Based on the massive amount of change in healthcare delivery and financing over the last 5 years, you can be sure that there's something new or different around every corner. So let me try to address 3 issues that may impact you and your practice in 2016 and beyond. They are narrow networks, billing for advanced care planning, and medical cannabis. As we enter the 3rd year of the individual and small group health insurance marketplace created by the Affordable Care Act, we continue to see volatile changes in network formation here in Illinois and a movement toward narrow networks of participating physicians and hospitals as a way to keep premiums down. For example, the largest health insurer on the marketplace, Blue Cross Blue Shield of Illinois, no longer sells a broad PPO network, which previously included nearly every hospital in Illinois. In 2016, they have replaced it with a much narrower network that includes only about half of the hospitals in state and excludes many of our state's preeminent teaching hospitals. Patients not paying attention to these changes may find that their BCBS plan for 2016 doesn't include their preferred hospitals or their preferred physicians. In reviewing the marketplace offerings, we're also seeing an increase in out-of-pocket costs for patients, and this includes higher copays and coinsurance responsibilities, an increase in monthly premiums, and larger deductibles. Unfortunately, with many of these changes, you may find your practice has to spend more time pursuing payments directly from your patients. That's why it's important for physicians and their practices to know exactly which health plans they participate in and what the terms are for those plans so that you can help your patients understand the changing landscape. This may lead to some uncomfortable conversations with patients, but the new normal is an environment where patients bear more of the cost burden for the care they receive. ISMS continues to advocate for greater transparency so that patients can know with certainty whether their physicians and preferred hospitals are included in their health plans, and so that physicians can confirm that patients are up to date with their premium payments before delivering care. ISMS is also considering legislation that would ensure that if a physician is removed from a health plan without cause, that his or her patients be given an opportunity to switch into a plan that includes that physician. We wanted to let you know that as of January 1, 2016, Medicare has agreed to reimburse physicians for time spent consulting patients on advanced care planning and end-of-life decisions. Reimbursement for the first 30 minutes of an advanced care planning consultation can be reported by using CPT code 99497 and will be reimbursed at approximately $86 in an office setting and $80 in a hospital setting. Medicare will also reimburse up to $75 for an additional 30 minutes of consultation, which can be billed by using CPT code 99498. And you should know that the Illinois State Medical Society was integral in bringing about this change. 2 years ago, several of our dedicated members initiated a proposal that eventually led to the creation of the CPT codes that Medicare has now agreed to pay for. This is another example of how your medical society continues to advocate for changes in the best interests of your practice and your patients. And my final issue, starting late last year, Illinois' medical cannabis pilot project got up and running, with medical cannabis showing up in dispensaries for the first time in November. With product now available, it's likely that patient demand will start to spike, and you may have already encountered patients requesting medical cannabis. It's important to remember that physicians do not prescribe medical cannabis. Rather, a physician may certify that a patient with whom they have a bona fide relationship is eligible to participate in the medical cannabis pilot program if you treat that patient for a qualifying condition and if it is your medical professional opinion that the patient is likely to receive therapeutic or palliative benefit from the use of medical cannabis. If you think you might be certifying patients as eligible for medical cannabis, it's crucial that you understand the law and what your responsibilities are. The Illinois Department of Public Health oversees the certifying process and has documents and educational resources available on its website. And the Illinois State Medical Society offers our members resources to better understand the law with regard to certifying patients as eligible for medical cannabis. 2016 promises to be an interesting year. There will, of course, be other issues that will impact your patients and your practice, but we wanted to bring these three to your immediate attention. Thanks for listening. Please know that we'd also love to hear from you about issues that you feel could benefit from our attention and our advocacy. Here is how to reach us.